be getting us started today. First, I want to cover a couple of quick housekeeping items, and then I'll turn it over to our first panelist. The first is that this webinar is being recorded, and a link to the recording as well as a PDF of the PowerPoint presentation will be provided via email to all registrants for today's webinar. Additionally, you may type in your questions as we go using the on-screen control panel. Simply type your questions into the questions box, and we will revisit those at the end. So with that, I would like to turn it over to Wendy Peters-Muschetti.
Great, thanks. Actually, could you go back so I can read the title? Sorry, Alex. Hi, everyone. This is Wendy. Good midday to everyone. Just welcome to Fostering Community-Led, Action-Oriented Coalitions that Change Community Policies and Conditions for Health. Research tools and case studies from the field. So you can move on. Thanks, Alex. This is Wendy Peters-Muschetti talking. I just wanted to greet everyone today. The webinar you're going to listen to today between now and 12:30, so just the next half an hour, is actually the first in a three-part webinar series happening this spring. Next slide, please. So I just wanted to quickly let you know what we're going to do today in our first of three series. I wanted to give a brief background on the Colorado Food Policy Network. It's sort of the key host and convener of this webinar series. And then the presentation today by Dr. Jill Litt will be Coalitions and Networks for Active Living, Lessons Learned. And then we will have it go to sort of an open Q&A for a few minutes before we close. So next slide, please. Oops. Okay, sorry, I had a weird screen freeze up there. So just really briefly before we move on, the Colorado Food Policy Network is a very nascent and emerging network of local food policy councils here in Colorado. It is comprised of about 16 or so individual food policy councils or food systems coalitions. They're called often quite two different names. The coalition has done a variety of work. It's come together so far to develop this shared purpose statement you see on the screen here, which is to promote healthy, community-based, economically viable food systems in Colorado that ensure all residents have access to affordable, nutritious food. In terms of the approach of the network, it is a collective, as I said, of state, regional, and local food coalitions. We are committed to building the capacity of local food systems coalitions to affect change. We are committed to advancing regional and state level policies, investments, and strategies, and to creating the conditions for deeper collaboration and impact. I'm happy to answer any more questions for anyone on the line about what exactly that means in more detail. But one thing that we have consistently heard as we begin to develop this network of food policy councils with the State Food Systems Advisory Council as well is consistent requests for skills and capacity building, especially around sort of leadership development and building strong coalitions that are really poised to affect local policy change. So based on some of that feedback, we decided to launch this three-part webinar series that aims to address particularly some of that coalition building capacity. So how do we really set up coalitions to be well poised to affect local change and to impact policy change around health and wellness? So in order to do that, we're going to kick it off here with our first speaker. Dr. Jill Litt is actually a member of our state Colorado Food Systems Advisory Council, which is a governor-appointed, legislatively mandated food systems advisory body. Dr. Litt is associate professor in the Department of Environmental Health, also at the Colorado School of Public Health, and an assistant professor in environmental studies at the University of Colorado at Boulder. So I'm going to stop talking at this point and pass it over to you, Jill.
Thank you, Wendy, and good morning, good afternoon to the folks who are participating. So I am going to share some lessons learned from the CANAL study, the Coalitions and Networks for Active Living. And at first glance, you might think, why are we talking about active living when this is about food? But this was a multi-year study that we conducted as part of the Physical Activity Policy Research Network. And there were a lot of things we learned that had parallel lessons kind of for the food side of the equation. And we would have loved to have had a more comprehensive study when we and I'll go into the details of the study, but for many of the coalitions that we interviewed and recruited into our study, they had a food side, but we focused mostly on the physical activity side. But I'll go through some of the things that we learned as we went through this process about what makes the network effective and the kinds of outcomes you might want to think about as your nascent groups might be starting up, or perhaps you're more established but thinking about evaluation. And then we'll kind of close with what this means for food policy councils in particular. Go to the goal slide. So the goal of our CANAL study was to evaluate the effectiveness of networks, and these were groups that were committed to advancing environment and policy change, which has a parallel to the food side as well for food policy councils. And we wanted to look at the kinds of strategies that groups were using and whether that was specific community engagement strategies, whether it was the use of social media, how people are engaging political and policy leaders, and so forth. So we wanted to get, and then we also wanted to know, does structure matter? You know, does a big group matter? Can it be small? Does size and shape play a role in how effective a group can be? And importantly, I want to emphasize that in the spectrum of prevention, so this was a diagram developed by the Prevention Institute, coalitions and networks are fundamental to advancing change. So this fits within kind of public health paradigms and other paradigms where policy and environmental change are a particular avenue for changing behavior and changing sort of health at the local level, at the individual level. So I just wanted to make an acknowledgement that this really is a vital piece of getting to change. Next slide. So in our study, again, I mentioned we partnered with the Physical Activity Policy Research Network, and through this network, we recruited 59 active living collaboratives into this study. We contacted about 90 groups across the country. We had certain criteria. For example, they had to be working on environment and policy change as a way to get to physical activity. And then groups had to be in place for at least 3 years. So we really wanted to know how groups that are slightly more established are doing in terms of advancing change. And we used two main ways in which we wanted to collect information. And these methods are very much accessible for groups now thinking about this on the food policy side. But we did an in-depth interview with coordinator leaders, but we also wanted to talk to partners, understanding the relationships of partners within this setting. And so we started with 96, we ended up with 59 groups. And then for each of these groups, we asked them to identify their core network. So these were folks, for better or for worse, that were very involved in the network. We wanted to understand how members perceive the success of this group. So we contacted 559 members associated, so organizations associated with the 59 groups across the country. And we had 390 respondents for the network survey. And I also want to mention that the network survey was developed by Danielle Varda, who will be speaking at the next webinar, to kind of go a little bit deeper into how do you capture the health of the network and the survey that we used. Next slide. And this just presents a picture of the 59 groups that participated. And the color scheme represents physical activity rates at the state level. And so the darker areas are areas, according to the Behavioral Risk Factor Surveillance System, that have the lowest levels of physical activity levels. So this is 59 groups, 22 states, and 12 groups in Colorado, and that's in particular because LiveWell was an important partner for us and helped us advertise and recruit within the state. Next slide. This is a picture of trying to put together what we were trying to understand, recognizing that there's the role of the organization, but there's also how the organization fits within this broader network. So we looked at things like leadership role, so whether there was a designated lead in the group or whether there was a council. We looked at sector affiliation, so what kinds of sectors were involved and the diversity of sectors. We looked at the resources contributed by different organizations, levels of trust, and so forth. We also looked at how these goals, the congruence of these goals at the whole network level. So we aggregated data up to look at sort of whether members were in agreement. And then the other important piece was the role of tactics and activities. So this has relevance whether it's active living or healthy eating, food access and availability. It's understanding how a group is engaging leaders, how it's using media, the kinds of events that it's advancing, and the role of advocacy and activism. So we saw that as sort of a mediating pathway to getting to change, and we wanted to try to capture that. The other thing that I'll mention here is that advocacy and activism can be viewed as maybe sometimes a scary word, particularly for groups that are funded by federal entities or states, or maybe foundations have certain rules about funding and advocacy. And so it's important to kind of unpack what that means. And we wanted to break that down and understand the use of information as it pertains to engaging leaders and so forth. And then we looked at 3 major outcomes: environmental change, policy outcomes, and perceived success. For the active living side, we identified core strategy areas, and we asked every group what they were doing to advance these particular strategy areas. There is the parallel that could happen on the food side, and I'll give some examples where we've started to develop a prototype. But this was also developed with a lot of input from different states working on this, foundations, organizations, folks who are in the know and could say these are the core things that coalition groups are trying to do. So in this case, the examples are parks and recreation, transit and parking, plazas, and so forth. And then for every environmental change that we were trying to understand, we surveyed and asked about how far along the change was. Was it in a discussion phase? Was it in the planned phase but not funded? Was it funded or in progress, or was this change completed? So we wanted to get a sense of progress for each type of strategy that a group was working on. And then we also asked, did it require some kind of policy to support it? And so we asked, again, to evaluate where the policy activities were happening. And that was no new policy was required. A group maybe identified a policy gap, but no action was taken, and so forth, all the way to policy adoption. And I wanted to give an example of just how we have kind of conceptualized it on the food side, and this is obviously like a very early prototype. This was a student capstone project by Max Gibson at the School of Public Health here in Colorado, but we thought that the major kinds of categories that might fall, and just to give you some examples, so environmental changes would be one area of work through a Food Policy Council. Local policy changes, federal and state policy advocacy, different kinds of education and demonstration programs, events, social media, and social marketing. Next slide. And then just to drill down a little bit more, so with each strategy we wanted to get a little, or for environmental strategies we wanted to get a little bit more specific, and this is just, again, an example on the food side to give some food for thought, excuse the pun. Local production, community and school resources, direct markets, retail, product promotion, food banks, and other. And then you can see that for each strategy area, we gave a definition of what kind of would fall under that umbrella. So for local production, I give one example here, breaking it down by environment, program, and policy. Okay. So what can you do with the data? So this is an example of what every collaborative that participated, so all 59 groups received a detailed report after the end of the study. And this allowed us to compare how this group was doing with the total sample for the 59 groups. So the blue is the particular collaborative that we were interviewing and sort of evaluating, and then the kind of summary of all the groups together. And you can see that the average score for the group on environmental change is 3. So for that group, they've been able to fund their initiatives, which is really important to know and kind of see on the continuum where they're at. And then, but how they stack up is that for most of the groups that we interviewed, they were sort of more in the progress towards completion phase. And this makes sense, particularly for the age of the group, might explain why one group is not as far along as another. And then on the policy change, the average was somewhere between identifying a policy gap and identifying and discussing. Whereas and then the average for the full network, or the full group of groups we evaluated, was more along the identified and discussed. slide. And this is another example of the kinds of metrics you could use to evaluate group effectiveness. And these are things that we found in the literature to be important, and also through some qualitative sort of prep work that we did in getting ready for the research. And so we looked at age, we looked at average funding of the group, and again, for groups that have been around a longer time, you might expect to see more funding. Whether there was a lead agency, the experience of the coordinator, and the number of partners in the group. We also asked about events, like the number of community events people hosted. And events is another sort of tough activity because certain funding opportunities might restrict paying for events. And we wanted to know whether events are effective, and if so, how. And then the use of social marketing and social media. This slide represents another set of metrics that we use and turned out to be the most important thing we looked at in explaining a group's success. And this kind of touches on the advocacy piece, but if we could step aside from the advocacy word, it's the actions that groups take to share information, engage leaders, and so forth. So we used a set of questions developed by Meredith Minkler and her group at the University of California, Berkeley. And this looked at a range of things like engaging with elected officials, community leaders that have participated or endorsed group events. You kind of can see along the continuum written advocacy, providing testimony, participating in hearings. So really gauging how involved a group was in sort of outward-facing activities. And this is a pretty picture of a network, different kinds of network configuration. So Danielle Varda, who developed the tool that we used, allowed us to put together this kind of picture for every group we interviewed. The thing to take away from here and one to tune into at the next webinar is that shape and size maybe don't necessarily matter as much as kind of what you do with the members you've convened. And so that the highlights here is that you could have a very, very sort of cohesive group where everybody knows each other really well, and leadership is evenly distributed across members, and that would be the image on the right. And on the left, you might have a strong designated lead. It might be a little bit more hierarchical, but that lead is able to activate relationships and leverage connections really effectively. So you could have two groups that look very different in structure, but be equally effective. So that's just something to highlight. And so that kind of brings me to the concluding slide. So we did run models, being the good researchers that we were, that we really needed p-values and statistics. But the things that really stood out was that groups who are trying to advance environmental change had a strong sort of foundation in events, using them to engage others, to raise awareness, an opportunity to bring in elected officials, and also engaging in media advocacy. So making sure that people knew what this group was doing. On the policy side, getting involved in the political and policy process was really important and helped distinguish groups in terms of their success. Offering testimony was something that stood out very strongly in our models, and also engaging community leaders. So looking forward, food policy councils may be one of the newest permutations of collaboratives coming together to advance environment and policy change. And there's opportunities, because these groups are in their fledgling stages, to capture kind of what's happening with how groups are structuring the kinds of membership and relationships, and thinking about the different kinds of tactics and activities used to engage stakeholders. Partner, which is the tool we use to evaluate networks, is something that's very accessible. It's affordable because it's free, and it can provide an opportunity for groups to self-assess. So that's all I have for today. I do want to acknowledge our partners, the Centers for Disease Control and Prevention, the Physical Activity Policy Research Network, the many communities and individuals who share their time, stories, and success, our local partners, Kaiser and LiveWell, Colorado, Wisconsin Department of Health Services, and Denver Environmental Health. So thank you.
All right, Wendy, I'm going to turn it back over to you. I don't see any questions coming in right now. I will remind the audience that you are welcome to submit your questions by typing them into the questions box on your on-screen control panel. Wendy, go ahead and take it away. Do you have any thoughts while we wait for questions to come in?
Great. Thanks, Alex. Yes, please. So anyone, please go ahead and type questions in for Dr. Liz as we go on. I have a question. So about we have that slide on characteristics of successful groups. And so you looked at what types of activities would tend to lead to environmental and policy change. I'm wondering, though, on that slide where you listed many different potential policy and political activities, were there any activities that you found that really just did not sort of correlate with ultimate policy change in the end? Does that make sense? So showing us which activities tend to absolutely lead to policy change is great. Are there some activities that you see groups doing a lot of that actually aren't at all correlated with leading to policy change? Does that make sense?
Yeah, so I probably would have to dig into the data, but I can tell you that kind of surveying on work groups didn't seem to have a big, it's hard to say because I think they're all related to one another, but what I can say is that engaging with elected officials really stood out as of all these activities. It sort of got above the noise in terms of having an effect on group success. And then engaging in kind of media activity really stood out, or advocacy was an important correlate of group success, and partnering with elected officials or community leaders were sort of the things that really stood out. And then the others, it's hard to know. I mean, for a new group, maybe they reported that they engaged with the school district or school board official, but maybe that was sort of something that would open up opportunities for further engagement and more substantive work. So they might be gateway activities that may not show up statistically, but could be important.
Great. Thank you for that. We do have a couple of questions coming in. I encourage you all to type your questions in as we go. Our first question comes from Brad. Have you developed a document on how a group may evaluate themselves or others, or is this partner tool self-explanatory?
So there is, I should have provided the partner website, and I think we can provide that to the participants today, and that's available through the University of Colorado, Denver. So there is a manual on how to use partner. There are instructions on how to download the data, how to evaluate it, how to launch it. They also have Danielle's group, she has designated staff that are available to kind of walk groups through it if they choose to do this.
Great, thank you for that. I believe that answers our next question. Will we have access to the partner tool? That information will be included in the follow-up webinar, the follow-up email, which will include a link to this webinar as well as a PDF of the PowerPoint slides used today so that you can reference those at your own time. I don't see any other questions coming in right now, so I'm going to go ahead and advance some of these slides while Wendy may want to explain some of the contact information and provide any additional information that folks might need after the webinar.
Great, thanks, Alex. And just let me know, since I can't see them, if any other questions come in, and just interrupt me, okay? Anyway, I just wanted to provide my contact information and Dr. Lip's contact information. Also, to note that at the beginning, I also had a bit of a screen freeze, so I apologize. I may have forgotten a few things. But I did note, as we were getting on, that there are a lot of folks on this call that are not from Colorado, so perhaps I should have introduced us a little bit better. I am an independent consultant, but I do provide staff support for the Colorado Food Policy Network, and I also provide staff support for the Colorado Food Systems Advisory Council, our state-level council. And both of those staffing contracts are supported financially and in other ways through LiveWell Colorado, where Alex and Jill are, and hosting this webinar today. So for those of you outside of Colorado having questions about how we're all working together, please feel free to follow up with me at any time. I also just wanted to let folks know, as far as the Colorado Food Policy Network, we do not have, back to the other slide, sorry. We do not have a web presence at all yet, but we do have a Facebook group. So I just wanted to remind folks, if you're not a part of that, that's our Facebook group. Also, I just like to inundate people with emails. So anyone can always email me and sort of get on my group list of folks that I email at least once a month, if not more, that are part of a local food systems coalition or a local food policy council. So ways you can track us down. So I'm sorry, go ahead, next slide. So I just threw a few other resources in here. We'll probably keep coming back to this slide and maybe enhance it. But one thing when we talked about to the presenters for this 3-part webinar series is one issue that we all kind of kept coming back to but aren't going to have sort of a devoted webinar about is just sort of this issue that we've heard a lot from local councils about. Really, how do we bring new leaders into this and the importance of doing that in coalition building and the importance of sort of, creating maybe perhaps new power dynamics and new ways of decision making. So it's not always the same people all the time talking to each other, which I know all of us every day experience. So I just wanted to flag a few resources that have come across a lot of national listservs recently, folks who are doing food policy work. Just a few resources that other folks in the food policy world around the country have used to, in fact, assess their own coalition's ability and guide their coalition's ability to focus more on leadership development, non-traditional voices, and equity, and how to sort of more explicitly do that through your participation. So just a few resources. We'll have sort of these slides at the end of each of the webinars and come back to them. So the next slide will introduce, I just want to flag our next in the series. So I'm really glad there are questions about the partner tool because that will be the focus of our entire next webinar. So for those of you all over the country apparently who are interested in a more in-depth explanation of this tool so that you and your own coalition can have a tool to use to evaluate your work, please, here is the registration link. Please go ahead and register for that if you have not already. And then the third in the webinar series will be the very last day of the month. We'll be hearing from Molly Hansen, from Colorado on the line here. Probably has heard of Molly. She works at Jefferson County Public Health, so she will be able to give a more sort of like lessons from the field on the ground. Someone who's been down and dirty doing a lot of coalition building to talk about building diversity within your coalition to actually ultimately change policy and conditions in community and organization. So that'll be our last in the webinar series. Again, please register if you have not already. Shoot me any questions about any of these anytime. And then I just want a quick question for those of you who are not from Colorado. If you could at some point let our organizer maybe in the chat box perhaps let us know how you heard about this webinar because you're apparently from like Hawaii and Ohio and Iowa and all over the place. So if you could just let us know how you heard about this real quick in the chat box, that would be great, and that'll help me know how to follow up as well. Although we will obviously have your email from the registration. I'm good on my end, unless Jill and Alex, do you have any closing comments?
Great, thank you so much, Wendy. I want to thank all of our attendees for joining us today and asking your questions. We hope to see you on future webinars. We are getting a couple of last-minute comments. Another attendee asked if the canal study referenced throughout the presentation will be available, and Dr. Litt, can you share that with me so that I could share that with our attendees today?
Yeah, I will provide the references for the papers that have been published. We have another pending right now on the actual network analysis. And I will also look into the sharing allowances to see if I could just distribute the PDF.
Great, thank you so much for that. All right, thank you all again for joining us. I want to give a special thank you to our guest, Dr. Litt, as well as Wendy Peters-Muschetti, and we look forward to seeing you at our next webinar. Thank you all so much.